we have a culture of where there's a lot of respect for people in the medical profession, and people are at times very timid and reluctant to really describe how they're feeling and what their problems are. Have you noticed that?
Sometimes. I have to say, don't be afraid to explain what it is that you have or to ask your questions, because that is what the doctor is there for. And you have to realize that the doctor is not a computer or a psychic. It really is just racking your brain to figure out the mystery that someone is presenting. So see your doctor as a detective, and you hold the clues to the mystery that has to be solved. So the clearer you present your clues to the doctor, the easier it is for the doctor to figure out the puzzle, to solve the mystery for you, because it's literally listening to what it is that you're bringing to the consultation, what you're feeling, what you're sensing, what has changed, together with maybe some physical examination that may or may not have to be done to clarify a couple things that the doctor actually has to think about and figure out what it is you're coming with. So if you're very shy or bashful about mentioning certain things, that's pieces of the puzzle that may be missing. And there's certain things that are easier to talk about than others, I realize that. But your doctor is accustomed to talking about these things, and sometimes the doctor themselves can make it easier by asking certain questions that you may not dare to ask yourself. But it's important that if you want answers or you want the doctor to have the full picture, to present what it is. Don't be afraid to say what it is that is bothering you.
Another thing, and some doctors have told me this, is that the ability to accurately describe how they're feeling, and it's mainly local people now, it's sometimes very difficult.
Yes, that is true. How do you put something that you're feeling that's intangible into words? You can only do the best that you can. The doctor can try to assist you somewhere when they get a feel of maybe you're trying to indicate this or that by making some suggestions. Do you mean burning or sticking or itching or whatever it may be? But you're going to, in the end, have to indicate what it comes closest to give the doctor that feeling, because the doctor cannot feel what you're feeling. So you have to somehow try to translate what it is that's going on in your body or in your mind to the doctor so that they get the best possible picture to help you figure out what it is. Just try your best to come as close as you can as possible. And imagine that if you have difficulty already explaining what it is that you're feeling and the doctor can't feel what you're feeling, how difficult it may be for a doctor to understand what it is that you're feeling. So it's a teamwork of trying to collaborate and get clear on what it is that is going on.
Another thing is that some doctors don't like the patient to ask many questions, and that a lot of people on this island, especially elderly people over the past years, have experienced that.
Yes, well, I'm not one of those doctors, and that's what I said in the beginning. You have to focus on that one main thing that you really want to dig into with a doctor and leave space to ask questions, because if you're rushing through multiple things and trying to squeeze them into one consultation, I'm going to guarantee you that your doctor is only going to give you not even a half an answer to each of them. That's a logical arithmetic right there. You should be able to ask your question. That's what the doctor is there for. And that can come in different phases during your consultation, during sitting with a doctor. It can be at the very beginning when you're telling your story on what is going on, what you're feeling, what you're worried about. Be clear on what your underlying question is. So maybe you're coming with, let's say, a cough, which could be caused by anything. It could be the dump smoke. It could be a flu that you have. Maybe the doctor might listen to your lungs and come to the conclusion that, it's flu season, you have a stuffy nose with it. It'll be a virus, so a common cold or flu-like problem. But if in the back of your mind, you just heard that your uncle, who also was a smoker like you, got lung cancer diagnosed, and you're worried now with this cough that you might have lung cancer, but you didn't ask the doctor that specifically, they might not think to answer that question because they don't know that that is a question that you have. So my advice is to, if you have an underlying worry or concern, even though on the surface, it might seem like something else, and the doctor's diagnosis is something else. In the first stage of the consultation already, you're allowed to say, hey, I'm worried, could it be this or that? There's nothing wrong with that. And then later down in the consultation, so in the sitting with the doctor might say, this is your diagnosis, this is what I think it is, and you're allowed to have questions about that as well. Ask the questions. The doctor should be able to answer questions about that.
That's another very, very delicate area when it comes to local people, because over the years, and this is before you came back to the island, many European doctors tend to not want a patient that is asking too many questions. You know, and not all of them, but some, and people have complained to me too about it. So how do you get around that? Because, you know, it happened to people in the past, and I assume it's still happening. Asking questions, the doctor, you ask too many questions, or you don't understand what you ask. And these are things that doctors tell patients, unfortunately, on St. Martin.
Yes, there are different factors there. If that's the response that you get from your doctor, that could be for several reasons. It could be just the doctor's style of working, that they don't like patients to ask questions. They want to be the one to say, this is it and this is what you should be, and that's the end of it. That is a style of working. It is more commonly from the past, though, than modern medicine, and more seen in general practice. Nowadays, at least in Dutch medicine, but also in different countries, you have a specialization to family medicine, where attention is paid into training the doctors as specialists on how to communicate with patients. So that type of response would no longer be acceptable for a specialist in family medicine. So you're less likely to get that kind of response. Yeah. The second thing is a doctor might be rushed a bit and not have the time to explain. That can happen. Again, my warning in the beginning, take that main thing and make sure that you have enough time. The time is there to spend, and make sure that you get the answers and you have the space to ask the questions. And in the end, if you don't get the answers that you want, you may consider switching to a doctor that will answer your questions, because in the end, that's the whole point of going to the doctor. You have a question or a concern medically, whether physically or psychologically or a combination of the both, and you're going for answers. So if you're not getting the answers that you want, that would be a little strange, I would think. So that would be some food for thought.